Hey y'all, I just got this new fancy lecture equipment stuff. So I'm going to try it out tonight and do a quick little tutorial on the 5 categories of neural functioning. This is supposed to be a T. 5 categories of neural functioning, okay? It'll be super simple and super straightforward. That is kind of messy, so sorry. I'm still learning how to write with this little tablet and stylus, so just bear with me. All right, so let's have a little patient. We will call him John Deere. Now, John Deere is a country boy. He loves to ride his tractor and his four-wheeler and go hunting and fishing. So he goes out one day to go hunting, and here's his gun. Looks like a fishing pole. We'll make it a fishing pole. All right, so he goes out to go fishing, and he rides his four-wheeler. While he's riding his four-wheeler, he crashes. The crash. So when he crashes, he falls, and he busts his brain. So he gets a brain injury. He's sad. All right. So his brain is injured. Maybe there's some blood coming out. Drip, 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 drip. All right, so after John Deere has a brain injury, what are we going to look at as his nurse? There are 5 categories, 5 things we're going to look at. 5 neural functioning clues. The number 1, most important one we're going to look at is his level of consciousness. So how is he acting? Is he tired? That's the first level, and it tells you that there's something going on. So maybe he's really tired, he's sleeping. Is he really confused? He has no idea what's going on, okay? So it ranges from lethargy to being in a stupor. There are a few other categories in here, but we're just going to go over the basic ones. And the most severe is a coma. In a coma, he's totally non-responsive. So no more fishing. He's not doing anything besides laying around and being non-responsive. All right. So that's the first one. The second thing we're going to look at, number 2, is his breathing pattern. How is he breathing? Remember, we're going to look probably at his spirogram, breathing in and out. So there are a few things we're going to look at for this. We're going to look at the rhythm and the rate. How fast is he breathing? Is it slow? Remember, slow rate would be bradypnea. Fast would be tachypnea. We're also going to look at the pattern. What we're really looking for here with this is if he has this really ominous sign, which is Cheyenne-Stokes. Cheyenne-Stokes pattern. So there shouldn't be an S there. Cheyenne-Stokes. So this is ominous, it's really bad, and it means that he probably has some type of a brainstem damage going on. Real bad. All right. Okay, the next thing we're going to look at after his level of consciousness and his breathing is what's going on with his brainstem may lead to some vomiting. Now, vomiting is a reflex that is associated with traumatic brain injuries, and here he is vomiting. And it is a reflex, and it often uncontrolled, forceful, propulsive vomiting is a sign of a brainstem injury. And then less commonly, but you do sometimes see it, is nonstop, uncontrolled yawning or hiccuping. And both of these are reflexes that are also controlled in the brainstem, and you see them occasionally with brain injuries. There was a whole episode of Grey's Anatomy where a lady had uncontrollable hiccups, and she came in for that, and she ended up dying. I don't know if she had a brain tumor, but she might have. Okay, the next thing we're going to look at are his eyes. So John Deere has nice baby blues. However, after his brain injury, we're going to see some oculomotor changes. Now remember, oculo, this part right here, this section of the word means eyes, and motor is the movement. Okay? So oculomotor changes are really indicative of brainstem, or, not brainstem, well, some brainstem, but traumatic brain injuries. So oculomotor changes, you see these really with the pupils, the pupillary changes. So there are a few things that we look at with the pupils. Number one, are they dilated normally, and are they responsive to light? So we look at their reaction to light. Actually, this goes over here. And we look at their shape. Are they symmetrical? Are they both the same size? Is one of them bigger than the other? Is one of them bilaterally dilated? We also look at the size in millimeters of both of them. Size in millimeters. Sometimes your pupil can be partially dilated as well. That's where you have a weird shape. Okay. The second thing we look at with eyes, this will be A, and then we'll have B. We look at the gaze. So disconjugate gaze tells us that there's something going on with the neural control of the eye. So disconjugate gaze would be like if one eye is looking upward, the other is facing centrally. Or maybe they're both deviating in. Sign that something bad's going on. Okay, the last thing we're going to look at is his posturing. And we classify this as a motor response. So the motor responses tell us a lot about the cortex, the cerebellum, and the lower motor control. So we're looking at, with motor responses, posturing. So typically, if you do a sensation or tactile test on a patient, they'll have responses that range from purposeful, so they are deliberately responding to you, like if you ask them to wiggle their toes, and then all the way to no response at all. And then posturing is an involuntary response. It's an abnormal motor response to painful stimuli. So we have two types of posturing. We have decorticate, which is the less severe, and then we also have decerebrate, which is the more severe. Decerebrate. Sorry for my messy handwriting. Okay, so with decorticate posturing, your patient has their hands and arms flexed and adducted. Remember, adducted means they're added into the body. A-D-D. They're added in and flexed. So that's decorticate. With decerebrate, the arms are extended, hands are clenched, they have plantar flexion still as well. So decerebrate is the more severe of the two types of posturing. So this tells you a lot about what's going on with John Deere, and is a brief overview of the 5 categories of neural functioning. I guess more appropriately we would call this the 5 categories of neural pathophysiology. All right.